The neurovascular program here at Munson Medical Center, we anticipate seeing roughly 30 to 40 ruptured aneurysms a year. So those are the aneurysms that have broken open and bled. There will also be an additional probably 40 aneurysms plus that we find incidentally, meaning during a workup for a headache or during imaging for another reason such as a trauma or something along those lines.
My name is Joan Gamache, and I am 77 years old, and I'm a retired clinical social worker. My husband and I have 7 children, 15 grandchildren, and 12 great-grandchildren. My husband and I were sitting out on the deck, and it was a beautiful day, and I was coming into the house, tripped at the doorway and fell head first against the oak coffee table and put a good-sized gash in my head, and I was bleeding like crazy. My husband called 911. They came and hauled me to the emergency room at Munson Manistee Hospital, and I was sewn up there. The doctor ordered a CT scan, and in order to see if I had a concussion, which I did not have, but they did discover the aneurysm on the left side of my brain. And it was a large size, and they were quite concerned about it. So they referred me up to Traverse City.
The blood vessel imaging revealed an aneurysm that was very, very large, what we call a giant aneurysm. It was over 2.5 centimeters in length. This is comparable to the size of a golf ball. And so if you think of a normal blood vessel in the head being roughly 2 to 3 millimeters, this aneurysm was roughly 10 times larger. And so the rupture risk of an aneurysm of that size is roughly 40 to 50% per year. And that's cumulative, meaning that every year that aneurysm has a risk of rupturing roughly 40 to 50%. My first thought was, wow, how has this gone and undetected for so many years? The second thought was that she really needs to have this treated to prevent down the road problems such as a life-threatening brain bleed.
Actually, the fall was a blessing because, as it turned out, the aneurysm was pretty dangerous, and things could have not turned out well at all.
Joan's procedure was quite involved, and we knew that we needed to preserve both vessels coming out of the aneurysm to prevent her from having any post-operative strokes. It's for this reason that we used dual endovascular open vascular techniques, having access through her wrists for an angiogram, a small catheter to be placed in her blood vessel of her neck, that we could do live angiography runs to make sure that we were clipping the aneurysm and reconstructing the vessels that needed to be preserved. We had completely excluded the aneurysm at the end of the case and maintained the patency of the 2 distal vessels. Joan's rupture risk was effectively reduced from 40 to 50% per year down to less than a fraction of a percent.
If I had not gone to Munson and had this aneurysm taken care of, I very likely could have had a stroke. I could have had a severe stroke where I would have been paralyzed on my right side and been speechless, or I could have died because, as it turns out, it was such a large aneurysm. By the time any doctor could have probably got there, by the time I would have gotten the treatment I needed, who knows what would have happened.
Joan and my relationship has grown throughout our treatment course. When Joan first met me, we were strangers, as most patients are to their physician. But part of my job is getting and being able to understand a patient and their family as well as their needs, and then planning their treatment around their needs with my expertise. And that's the most rewarding part of my job, is being able to pick a treatment, do both treatments, endovascular or open surgical, that fit with a family and a patient's wishes to get them back in life where they want to be.
Well, I'm back to doing everything. Actually, after 2 weeks, I was back to singing. I sing in a small group at Divine Mercy Parish, St. Joseph Catholic Church, and climbed 28 steps up to the choir loft. We sing for the masses on the weekend. So I started doing that after about 2 weeks.
Joan has made a remarkable recovery. While her aneurysm had not bled, it was very thin and likely would have bled in the coming years. There's only a few centers in Michigan that are taking care of aneurysms this large or to this complexity, requiring numerous clips to be placed and replaced and reconstructing those two parent vessels that need to stay open. Munson Medical Center is now one of those centers that takes care of complex neurovascular cases.